Let's talk about chronic low back pain that keeps coming back, but you're in the gym all the time, that you work out all the time, that you're doing everything you can to protect your back, but you still get back pain. Maybe it goes out once a month, once every 2 weeks. Maybe it's just there every day, and some days it's worse. Well, what could be the problem? It could be an imbalance between the left and the right and the front and the back muscles. How do you know? Well, the simplest way to find out is to check your relative perceived exertion, left versus right. Because if the muscles on this side aren't as strong as the muscles on that side, you are vulnerable for chronic recurrent lower back pain. That's right. And how close do they have to be in symmetry? Within 10%. Don't need fancy equipment. Don't need to go to the gym to figure this out. You just need to be able to do a good plank. So let's just show you with a 3-point side plank. Come on up and hold it. Nice and straight, keeping this up. And you can do it one of two ways. If you're fit and you exercise a lot, hold this till you can't hold it anymore and time how long that is. And as soon as you start to drop, as soon as you start to falter, you're done. All right? Now, let's say you're not as fit, but you're still having recurrent back pain. Do the same thing, but for 30 seconds. At the end of that 30 seconds, rate yourself from 0 to 10 on how hard that was, your relative perceived exertion. If your relative perceived exertion after 30 seconds on the right and on the left with the same exercise is within 10%, you're okay. That's not your problem. But if it's greater than 10%, it's a huge problem. Can you do the same exercise with a straight-legged side bridge? Sure can. Make sure you're square. Excellent. As soon as this starts to give, you're done. Time how long that is. If it's more than a 10% differential, left side versus right side, you're not balanced. And that imbalance is going to make you vulnerable for recurrent back pain. Relax. That ratio really needs to be 1 to 1. So, simple test you can do at home. Check it out. If you also want to know why your low back pain keeps coming back, you better watch my video on the 5 worst exercises for your lower back. Make sure you're not doing those. I'm Dr. Donald DeFabio. Thanks for tuning in.